that I haven't really given an update since leaving the hospital. And for those of you who are new here, I had spine surgery to remove a tumor that was compressing my spinal cord, and that resulted in having a spinal fusion from T1 to T11 with 22 screws and 2 rods. So it was a lot to go through, and I've been dealing with a lot since the surgery and going through this recovery process. It's been a lot emotionally, mentally, and of course physically because of the pain. I will say that I feel like I'm doing pretty well given the circumstances. I'm able to walk around a lot easier, and I'm able to use the stairs easier. I've had an in-home nurse come to my house a few times to check on me, and I've had an in-home physical therapist come check on me. So I've been doing the exercises that they've given and just trying to do the best that I can. I will say, when I first got home from the hospital, it was a little bit of a learning curve because when you're in the hospital, they have you in their own routine with everything, and they come in around the clock to give you your medications and everything. When you get home, you kind of have to find your own little routine of everything going on, and so that was a little bit tricky at first. And then I made the mistake of not taking my pain medication because I was trying not to take as much, and that resulted in a spike in my pain levels, and it was so hard to get it back under control. So I've learned from that. We're not going to do that again. I also had a really hard time controlling my blood pressure when I first got home, and I've had a little bit of that as well, kind of sprinkled throughout my recovery, but it's not as bad as it was when I first got home. And that's just because I'm anemic now because of the surgery. I lost a lot of blood, and so my blood work has just been a little bit weird. So I've just had some drops in my blood pressure, but it is, I feel like, getting better. It has been just really difficult, like I said, physically, emotionally, and mentally. Of course, I cannot do really anything that I was doing before surgery right now because I just had major surgery. But with this surgery specifically, you cannot bend, twist, or lift. So I've needed a lot of help with literally like basic necessity type things like showering and using the bathroom. I've had to rely on everyone around me to do pretty much everything. That's been hard for me to deal with that mentally because I'm so used to being independent.